Identify the device. TrueCut biopsy needle. The TrueCut biopsy needle is designed for manual capture of high-quality tissue samples with minimal trauma to the patient. Example, liver biopsy. Identify the device. Bipolar forceps. The bipolar forceps securely grasp tissue, precisely dissect, and are able to effectively coagulate small as well as very large blood vessels with diameter of 2 mm to 20 mm. Bipolar forceps alleviating the need for surgical clips or staples. Identify the surgical instrument. Babcock forceps. Babcock forceps are non-perforating forceps used to grasp delicate tissue, commonly used in intestinal and laparotomy procedures. Identify the image. Humbee's knife. Humbee's knife or Humbee's skin grafting handle is used to harvest skin for skin grafting. Laparoscope or laparoscopic telescope. The laparoscope is a type of endoscope that is, a device similar to a small telescope that is equipped with a light source. It is used for laparoscopic surgeries. Identify the surgery shown in image. Arthroscopy. Arthroscopy is a minimally invasive surgical procedure on a joint in which an examination, and sometimes treatment of damage of ligament is performed using an arthroscope. Arthroscope is an endoscope that is inserted into the joint through a small incision. Arthroscopic procedures can be performed during anterior cruciate ligament reconstruction. Identify the surgical instrument. Jowls retractor. Jowls retractor is a self-retaining retractor. This instrument specially used for thyroid-parathyroid surgeries. Jowls thyroid retractor is a semicircular retractor with two blades attached with a handle. End of the blades are sharp like a towel clip. Identify the image. Nasal speculum or Keelian nasal speculum. Nasal speculum is used for examine the nostrils and treat diseases. Identify the instrument. Mixture or right angle forceps. The mixture or right angle forceps is hemostatic forceps commonly used for working in obscured surgical sites. They are most frequently used for clamping, dissection, or grasping tissue. Identify the image. Autoclave. Autoclave is the equipment used to remove microorganisms and spores using high pressure and high temperature steam sterilization. Identify the image. Insufflator. Insufflator is used to blowing gas into body cavity during laparoscopic surgeries. Carbon dioxide is the most commonly used gas for insufflation during laparoscopic surgery because it is colorless, inexpensive, non-flammable, and has higher blood solubility than air, which reduces the risk of complications if venous embolism occurs. Identify the image. Maryland dissector. Maryland dissector is a laparoscopic instrument for dissection of tissues and hemostasis. Identify the retractor. Thomson abdominal retractor. Thomson abdominal retractor is a table mount retractor used for explore the anatomical structures during the abdominal surgeries like Whipple procedure. Identify the image. Deaver retractor. Deaver retractor used to retract deep abdominal or chest incisions. Example, cholecystectomy. In cholecystectomy, the Deaver retractor used to retraction of right lobe of liver.